Hi, I'm Jennifer Hickel, and I'm an Ortho-Bionomy practitioner, and I'm also the owner of Inner Infinity Healing. So we are actually talking about dry eye today and introducing a dry eye self-care technique. But before I get into all of that, I really want to take a moment to talk a little bit about orthobionomy, and some of you may have gotten here as a referral through an orthobionomy practitioner, and some of you may have gotten here another way. So you might be wondering what this ortho word is I'm saying. So orthobionomy is a very, very gentle neuromuscular body work. It's really about working with what your body is already doing. So if there's a pull and tension, we have a knot, we're going to work by moving into that knot rather than trying to stretch the knot out. And what happens is we'll use a little bit of compression, sometimes for movements that are going out, we use traction, and we basically exaggerate the pattern, and then the body releases that. Think of untying a knot in a necklace chain. If you've ever done that and you've pulled on the chain, the knot's just gotten tighter. So orthobionomy works a little bit differently. And the focus is really about working as much in comfort as we can, and especially when we're talking about working around your eye. When the body is being worked with in comfort, it's going to make those neurological changes a little bit more quickly, and it will also hold those changes a little bit longer. When we're forcing the body to do something and we're stretching out that knot, it takes a little longer for those neurological changes to take place and really actually sink in and feel relief. If you want to find more information about orthobionomy, you can look more at innerinfinityhealing.com, or you can go to ortho-bionomy.org and find more information there. And at orthobionomy.org, you'll also be able to find a practitioner near you if you do not have one already. Orthobionomy is a principally based work, so we don't have hard rules and procedures where we're going A, B, C, D. We're actually working with the principles that form a structure, almost like a bowl that hold the work we work in. As we are following those rules, we're in orthobionomy, in that structure of the principles. So as you're working with your own eye, I want you to think about the fact that less is more. If you've ever done something that was really fun or good, like going running or hiking or anything physical where you've done more because it felt so good and your body paid the price the next day because you overdid it, this is a prime example of less is more. So we just want to use small movements, and we're not going to be using this technique on our eyes all day throughout the day. It's just going to take a few minutes at a time, and you're probably going to work with it anywhere between 1 and 5 times a day. It's not something you're going to need to do hourly because, again, overdoing is not going to help us. Less is more. Also, we're going to be moving with the ease of what our body's already doing. So I talked about that a little bit with the knot analogy. We're going to find the ease of what our bodies are doing. So if it's moving that to this direction, we're going to move gently with it. And I'm making big gestures right now, but this work is really often in millimeters, especially when we're working on our face. Those tiny movements, those are going to be moving with the ease. We're going to find out what that is like, and I'll explain that a little bit more in a moment. So we're also going to talk about the principle of working with our body rather than working on our body. Because we're finding that ease and we're moving with the way the body is going, and because we're doing less rather than more, we're actually finding ways to actually work with what our body is already doing to help it come in and say, this is the pattern. You can either keep it or you can let go. Usually we'll just let go. So we're going to talk about the anatomy of the eye, and I want you to keep in mind that as we're talking about all of these techniques, none of this is meant to replace what your doctor has prescribed for you, but rather to supplement it and increase the comfort in your eye area. So dry eye is caused by a combination of factors. One of those factors is the production of tears, and that comes from the lacrimal gland. So we're going to look at a picture of the eye. The lacrimal gland is right under our brow bone, between our brow and our eye bone. It has ductwork that moves the tears across the eyelid and dispenses them across the eye, and then continues on. Now, the lacrimal gland is important not just because it produces the tears, but because those tears are going to lubricate our eye, they're going to keep it clean, and when we need them to, they can also help wash out any dirt. The other part of dry eye is the fact that there is oil that covers the eye and helps hold in the tears. That comes from the glands underneath the eye, and we'll be working with that in this dry eye technique as well. Now we can start talking about technique, the part you've been waiting for, almost. So I'm going to talk first about what I call the plus sign. It's an intrinsic muscular movement. It's a lot of words. Basically, it's a really simple way of moving your body up and down or side to side in those small movements. Again, we're talking millimeters when we're working on our face rather than something big. But if you can make the plus sign up and down and side to side, then you'll be able to use this technique. Let me show you what it looks like on my arm. So when you come to do the plus sign, you're going to first find the place you're starting, and we're going to move just gently side to side, and we're going to see if we can tell which way goes most easily. And it's easier to feel than it is to see, so you can even play along and do this with your own arm. We're going to move to the outside and to the inside, and we can see that there's actually a little more muscle resistance when I go out than there is when I go in. And we're going to hold that, and we're going to let it move back. Now it's important that we're not taking this to the absolute maximum of the range of motion, because that is not going to be comfortable. We're going to start causing more problems. Another really important part of this is that we're not drilling down into the arm or the muscle. This is especially important when you get around your eye. You don't have to drill down. This is actually very, very simple. You can see the pressure on my skin is light. So less is more here as well. When we're moving with our muscles, it's going to be kind of like moving this rubber band when we're talking about to the range of full extent. We can move in here gently. Well, even this rubber band has a preference. Or we can take it to extremes. The extreme is just going to stretch our muscles out more like the rubber band. And again, ortho-bionomy is not stretching. So we're going to stick right in here. And even if we're just moving one part of that rubber band, the other side's coming along with it based on what we're doing. So very gentle little movements. We're going to be working with this large muscle that encircles the whole eye. And it covers actually from above our brows down to about mid-nose. So the lacrimal gland is underneath it, and it will also be working with and impacting the other areas around it. Even though we're not going to be touching them, there is a relationship between all of these muscles and also the fascia that is between and around and through these muscles. So we'll actually be working with a large area, even though our technique is going to take us just around the eye. Now we get to work with our eyes, the part you've all been waiting for. So we're going to start at the corner of our eye. We're going to be making small movements, just a millimeter or two. We're not doing anything silly like we're making a face. Don't do this. So this is going to be stretching. We're doing the opposite of stretch. So we're going to move just a little. We're going to check in, and we're going to see, does it like to go up more easily? Does it like to go down more easily? And you may have to move each direction more than once to figure out which one is most easy. And mine is going up right now. So we're going to hold that for a count of 10. And then we're going to release it. And then we're going to check in side to side. Does it go in? Does it go out? You can actually see perhaps the fact that if I go out, it's more like I'm starting to make a face. My muscles do not want to move that way. So we're going to move gently in. Not a lot of pressure. So remember, as we're working around our eyes, that the tissue around our eyes is some of the most thin and delicate tissue in our body. We're also going to be working along the edges of the bones, especially as we move up. So we start at the corner of our eye. We're going to move up along our eyebrow, and you can actually feel on your forehead, you can actually feel down, and you can feel where the edge of the bone is, where the eye socket begins. We're not going to be working in this soft eye socket area. We're going to be working on the edge of the bone. So in your eyebrow for most of us. So we're going to just move up a little bit at a time, just a little, and then we're going to just do the same pattern. Does it want to go side to side? Does it want to go up and down? And I'm going to do this a little more quickly so you get an idea of what it looks like rather than counting to 10 each time. So that way you don't have to wait through the whole video. So we're going to move all the way across, right? And I'm going to work towards the inside of your eyebrow. And this is a good place to stop. We're going to transition to underneath the eye. Now again, we're going to be working along a bone here, right? At the top of our cheekbone. And it's right at the edge. You can kind of see where things get softer under our eye above that. So right at the edge of the bone. We're not working in this soft space at this time. And we're not working down here because that's going to put us more in our sinuses. So right at the edge of the bone, And we're going to continue with our plus signs. Just little tiny movements, up, down, right? And then we're going to hold for a count of 10, just like on the top, side, side. You might feel your muscles start moving underneath your fingers as you get more practice and get an idea of what this feels like. And if you feel the muscles starting to move back against your fingers, it's okay to let go at that time too. You don't have to hold for a count of 10. So we're going to work along the edge of that bone. Again, I'm going to not do it all so you don't have to sit through it, but you can follow along. So we're just going to work nice and easy. When we get to the nose, we're actually going to take time to work on the side of the nose. We're not going to be down towards the eye. We're definitely not going to work on our tear duct, which you can see right in here. So we're going to be on the side of our nose, and we're still going to do the up, down, side, side bit. Very simple work, very small movements. And that muscle that we were looking at also reaches onto the side of the nose. And because it's so big, it's going to let us impact all of the area around the lacrimal gland and the ducts across our eyelids and help release muscle tension around our eyes. We're going to keep working right up to where we left off at the inside of the brow. Very simple, very easy, very small movements. So the next part we're going to do is we're going to work underneath our eye. And that's because oil will actually build up in these glands. And the idea is that your eyes should be moving that oil across your eye to hold in the tears like we talked about, to keep them from evaporating quickly. Now, I want to make sure that you're doing this part with your fingers. In fact, I want you to use your ring finger because it's the weakest. And it might be a little less coordinated if you haven't practiced doing other things with your ring finger. That's okay. Please make sure that you're using your fingers and not a tool. If you're using something like a roller and you're rolling onto your face, it's a little harder to regulate the pressure. Also, it's a little harder to know how hard you're pushing. When you're using your finger, you have the tactile input from your finger as well as what you're feeling on your face. So we're going to come in with our ring finger. It looks a little funny, but that's okay. We're going to start here and we're going to roll up. So we're just making a motion as if we're using our finger as a rolling pin, a very, very gentle rolling pin, and that will help express any oil from that area up onto the eye. So we start right at the bone. I like to start with my finger rolled out a little bit, and then we just roll it in. I like to close my eye, makes it feel like I'm holding more stuff in. And we're just starting, and I work all the way across. And sometimes I'll go across more than once. So then we just gently roll from one side of the eye to the other. Very, very, very gently. Make sure you get the corner. How's that feeling? I know I can definitely feel a little bit more moisture on my eye. Hopefully you are too. And that is what we're going to do anywhere from 1 to 5 times a day. And it just takes a few moments. Remember, less is more, less pressure, less repetitions. You don't have to do this 20 times a day. You don't have to do it for an hour each time. The technique is very simple. It is designed for you to be able to use this anywhere and not take a lot of time. And you can work with it. I usually do anywhere between 1 and 5 times a day, depending on if I'm traveling to dry climates. And as you work with this more, you may find that you need to do it less often because your eye is feeling more moist and your vision is a little bit easier and less strained because you're having more moisture stay with your eye. What can you expect when you are working with this technique? A miracle cure? I'm kidding. What you should come to expect is that you will be able to release moisture into your eye as a supplement to working with everything else your eye doctor's given to you. And that's going to be something I want you to keep track of. How many times a day are you doing this? And how does it work for you? Sometimes my eyes will produce a large amount of tears. Sometimes they'll produce a little bit. It kind of just depends on what the body needs. And the body gets to be the boss. This is just coming in and helping give it some options for change. Other things that you can expect is that you might feel other changes in your body. Sometimes you'll feel changes that are a sign that muscles are changing, that patterns of tension are releasing. You'll find that you might yawn as you're working. You might just have like really deep breaths spontaneously. Sometimes when I work, my ears pop, and that's because there's a relationship from all of this stuff we're working with here through the entire head. So what you find may be very simple and just around the eye, or maybe a little bit further reaching. But those things like the yawns and the deep sighs, and even the ears popping, yours may or may not, those are just signs that your body is releasing a pattern of tension and making a small change. So the other thing to expect is that it's going to take a little time using this technique before you see long-term changes. Most of us who are experiencing dry eye didn't just get there overnight. My eye doctor said it's something as we move forward in time that we can all experience as the aging process. I also think that there's a musculoskeletal component in this, which is why I use this technique for myself. So you may find that you have instant results. You may find that you have results in a few days. I've got some clients who feel instantly better and have that miracle cure with any ortho-bionomy technique. Okay, that's maybe 1 in 100 at best. And I have other clients that will have a technique used with them and it takes them a little while to feel a change. And most of my people are right in the middle. Yeah, and because this technique works with your nervous system, it's going to keep working even after you are not touching your face anymore, which is important to know. And part of why I want you to remember that less is more. Because right now, even after filming this video, I can feel more muscles relaxing in my face that we didn't work with. And I can feel more moisture continuing to be released from just the little bit of work I did in this video. And that's going to keep going for a while. So just pay attention, take careful notes of what's happening in your body, and make sure that you let us know on your follow-up survey. And you'll see more information about when to do your follow-up survey on the Inner Infinity Healing page for dry eyes. Thank you so much, and I can't wait to hear how this helps you.